how's everyone doing today? I'm going to continue with my background story that I'm talking about. So I ended up my first video of talking about going to the hospital and working up to my first surgery. So we're like March 22nd of 2022. I'm in the hospital and we're looking at trying to get an MRI to see what's going on. We've already got a CT scan and know that I have a tumor in my head. But we need an MRI to see how far it is and where it actually is as far as compared to other things in my brain. So we're waiting to do an MRI because I have to be sedated because I can't lay flat, unfortunately, and breathe because of my diaphragm is partially paralyzed because of my tumor. We didn't know that at the time, but it was right on my motor cortex, so I had issues with my diaphragm and with some other stuff. Sorry about the glare in the window. I'll try to adjust that on my next video, but right now I'm going to get a little glare on my glasses. Sorry. So March 23rd, I get an MRI. We schedule the surgery for the next day. At this point in time, after we get the MRI, we think that it's probably a infectious cyst. That's what that's what we think the diagnosis is going to be. So we're going in there looking to get a biopsy of some kind to figure out if it's a cyst or what. So March 24th, I have my first surgery, which was really tough on the crew because I trained almost all of the crew that worked on me. So some really good friends that had to work on me. So it was pretty rough on them. It was rough on me too. Still is. I get emotional when I talk about it. But they were all really professional. They did a great job. They're still really good friends of mine. And I'm sorry they had to go through that. But it is what it is. Sometimes we work on people that we know and it's a lot more emotional. I've had to do that several times over the last 30 years. So I get it. It sucks. So Dr. Gentry goes in there, does a craniotomy on me, opens my skull up, and goes in there and does a biopsy. We don't know what it is. Still thinking it's infectious at this point in time. So he sends things off to get pathology, things like that. We don't get the pathology back right away. The pathologist wants a second opinion. So the pathologist sends my specimens out to Johns Hopkins to make sure that what he's seeing is what he's seeing. He doesn't give us a definitive answer at the moment, so we're going to have to wait. So I'm in the hospital. I'm up on the floor. After surgery, I go to ICU. I'm in ICU overnight, and then I go to the floor the next day. So I'm on the floor waiting for my pathology results to come back. I wound up staying in the hospital for almost 10 days, not because I needed to, but because we were waiting on pathology to come back, because we didn't know if we were going to have to go back in, or if we're going to have to put me on IV antibiotics, or have to put a port in, or have to do some other procedure. So we stayed in the hospital for almost 10 days. And they finally let me go home because I really wanted to go home, because I was just basically sitting in a hospital room racking up hospital bills. So they finally sent me home, and the next Monday, which was April the 4th, I go back to see Dr. Gentry. My pathology's come back from Johns Hopkins, and they've confirmed that it's a GBM, which is a glioblastoma multiforme, which is the worst possible cancer you can get. It's a brain cancer, and it's the worst, most aggressive you can get. And I have the worst type of GBM that you could have. I have a stage 4 non-myelated GBM, which is the worst you can get. There's almost no treatments for it. The treatments that they do use are not very effective. There are a few things that they can do, which we're trying and we have tried. But the big deal with GBMs is they grow so fast that it's impossible to get ahead of them. And that is the problem with GBMs, and that's why they kill so many people, is because they grow so fast that the treatments and stuff just aren't effective in the amount of time that it takes for the tumor to grow back. So you wind up having to have multiple resections, multiple surgeries, and eventually the tumor grows so fast you can't stay ahead of it. So that's why GBMs are so bad. And the other aspect is you have a problem with drugs and chemotherapy and things like that going across the blood-brain barrier. And that's an issue in and of itself. Trying to get the drugs to work going across the blood-brain barrier. And I'll talk more about that in other videos. I'm going to do some more videos about what all this means and all that stuff. Just stick with me and keep following me. Look at my videos and I'll talk more about the blood-brain barrier and how GBMs work and how chemotherapy, radiation, all that stuff is effective or not effective. I'll go into more detail on that in other videos. But this is just background of where I'm at right now. So right now, we're on to my first surgery. We've done the first surgery. I've come out of the hospital. We've gotten the full diagnosis, which really sucks. So the next aspect of that is we need to do a debulking of my tumor. So debulking the tumor is requiring a second surgery. So Dr. Gentry is not comfortable because of where it's at. The tumor itself is right on my motor cortex, which is affecting my ability to move my left side. That's why they thought I had a stroke to begin with. So he's worried about paralyzing me. So he has referred me to a doctor at UT Southwestern called Dr. Bradley Lega. He's a guy that specializes in GBM stuff. He's done hundreds of them over the years, and he specializes in doing these at UT Southwestern, and they're kind of, right now surgically, they're kind of the top of the country at the moment as far as progressiveness. I've had multiple surgeons that I've worked with over the years that have requested that I go here. So that's why we went to UT Southwestern instead of MD Anderson, things like that. I talked to the guys at MD Anderson, and they actually said you should go to Dr. Lega at UT Southwestern. So that's one of the reasons we went to UT Southwestern versus going to the Mayo or MD Anderson, because people have actually been sending all of their patients to UT Southwestern because they're the most progressive at the moment as far as surgical prowess is concerned. So that's why we went to UT Southwestern, if anybody's wondering. UT Southwestern's great. They've been very great to us. The doctors have been phenomenal. The hospitals have been great. The service we've been provided has been phenomenal. Can't say enough about UT Southwestern. It's been great. I love going down there. It's very easy to navigate. They do things very efficiently. So I'm going to do nothing but praises for UT Southwestern. So I'm probably going to do another video on my second surgery, which is what Dr. Lega did down at UT Southwestern. So I'm probably going to wind up wrapping this one up for right now, and just watch my next video, and we'll talk about my third surgery, or my second surgery, which leads to my third surgery, and we'll go from there.